to practically introduce women in data?
Yeah, absolutely. So I'm going to start screen sharing my screen. Hello, everyone. Thank you so much, Gabriella. We really are happy to partner with GA because they host amazing workshops and panelists like this. And we have a super amazing panelists today. I'm sure you guys will appreciate this session. But a little bit about Women in Data, if you have not heard about us before, Women in Data was started by my sister, Sadie St. Lawrence, and she had a passion for having a community for women in the space of data. And our mission is to close the gender gap and increase diversity in data careers. So if you are a woman in data, you know in your company, there's not many women in your organization. And if there are, congratulations, you're one of the few lucky ones. So we started with one chapter over 5 years ago. And now, as you can see by this map, we are now international, and we are so excited about that. And we would love to have you join a chapter locally if you see a location on the map there. But if you don't see your own city, we'd love to have you become a leader and become a chapter lead and start, that community and building that awareness. So how we achieve our mission is through our 3 pillars, which is awareness, education, and advancement. And we not only want to make more women well known within the data community, but we want to educate them, further educate them. And we also want to advance in their careers. So not even just starting in the entry level positions, but then seeing them rise to the top in that as well. And so how we do that primarily is through our membership. And this is where we offer mentorship. So this is a personalized one-on-one mentorship where we have women apply, and we match them with women who are perfectly fit for what they're looking for right now in their career. Maybe they just are transitioning into data science, or maybe they've been 5 years in the industry. We also have residency programs. So for women who are looking to get into data science but need a little bit more experience, we have a data science coach work with them on real world data projects. Through that, we also have hiring resources. So maybe you need your resume looked over, or you just want some more information on how do I get my foot in the door in starting a job in data science. We have those available. We also have life coaching. So not only just data science, but just being a woman in a working field. We want to make sure that you feel supported. We have resources groups, and then our very active Slack channel. It's always a great thing. So we would highly recommend that you become a member or a partner with us today. I will be dropping the link to our website. And if you are unable to join as a member, we'd still love to keep in contact with you, sign up for our newsletter, or even join one of our LinkedIn groups. So that's a little bit about Women in Data. So I'll hand it back over to Gabriella.
Thank you so much. Such a fantastic organization. Yeah, drop some links how people can join in Zoom chat, please, because I believe everyone should join. Now I will share my screen for 1-2 minutes, and then we are going straight into the webinar. So you are joining this webinar. You will hear from all these fantastic women here in a couple of minutes. They will share about their career journey, their views, and their experiences. And before we will start, this is me. My name is Gabriela. I have been with GA for 4 years, and I am leading our West Coast expansion. What is actually General Assembly? Oops. We are a technology education company. We started in New York 10 years ago. We are now in 40 plus cities all around the world, and our headquarters is still in New York City. Because of COVID, we of course pivoted a little bit to more online model. So you can join us from literally everywhere via Zoom. But once we go back to normal, you will be able to meet us in our classrooms and event spaces in many cities. You can go to ga.co to check if we are in your location too. But what we actually do, we are teaching people digital and technology skills, such as coding, user experience design, data, marketing, business, and career development. How we do it? Our main programs are full-time programs for people who want to fully change careers. So that means you go, you explore what is your next step. You can join user experience design, data science, or software engineering. If you don't know what you want to do, but you want to go into tech, contact our admissions. They have perfect consulting for this. They work with some people even over a couple of months to figure out what is the best next step before signing up for the program, of course, if it's the right option for you. And then you will join the program. You don't need to have any prior skills. And within 3 months, you will become a software engineer, user experience designer, or data scientist. You will have very intense training. You will have career coaching throughout the program. And after the program, we will help you to find a job in the new era. 99.2% of our graduates find a job in the new era after graduation. On top of this, we have part-time programs. So that means you don't need to quit your job. You don't need to fully change careers, but you can just upskill. For instance, you are working in some tech area or marketing. You can take product management to advance in your career. Or you want to start a startup, product management will help you to take your idea to actual reality. On top of this, these part-time programs are about various coding languages from Python to React to JavaScript. We have digital marketing, visual design, user experience design, and more. Data analytics is actually our most popular. And on top of all that, we have tons of short workshops and webinars, just like this one. So you can go to ga.co/education to learn about our upcoming sessions. I even picked a couple of sessions here. So you can join us tomorrow, and we will be talking about recalibrating, nice word, your skills in the new age of work. So practically how you make sure that you are up to date. And actually on Thursday, we will be focusing on user experience design. It's actually thinking about accessibility and inclusion when you are doing that. And this will be in September. So Women in Data and General Assembly is bringing a workshop about product roadmaps. Oops, and I was speaking whole day on Zoom, so enough from me. And Ali, now it's yours.
Awesome, thank you, Gabriella. Well, we heard from Women in Data. We saw some slides, and it's amazing to see like there's such a reach across the world. And it's amazing to see that we have a lot of folks here in our class today, or in our session today, I guess, in our webinar today to just offer their opinion and let us know what they think. So that's a cue to you that if you have any questions, go ahead and drop them in the chat. So I'll be checking the chat periodically. So as we go along for the next hour or so, like I'll be checking periodically. So if I look like I'm looking over here, yeah, I am paying attention. I'm paying attention to you. Who is speaking? Who am I? My name's Ali Lyles. I am a design producer, essentially a product owner of the UX experience at USAA. I am also marketing director of FemTech Focus, which is a nonprofit that supports FemTech enthusiasts and entrepreneurs, connects them to networks and capital so they can get their businesses going. I am formerly a lecturer at General Assembly, and I was one of the original matriculants in a General Assembly class in Flatiron too many years ago. So that's a little bit about me, and I just want to toss it to our lovely panelists for today. So I would toss it to Joy.
Hello, my name is Joy Rios. Thank you for inviting me to be part of this panel today. I'm really excited to be here. I am the co-founder of a health IT consulting firm that supports clinicians in navigating value-based care, sort of cut my teeth on trying to understand US healthcare laws and how Medicare reimbursement. So to that end, I've written 5 books on the subject and basically help medical practices collect the right data, create workflows around collecting data for quality measurement, and then getting it over to the government on an annual basis. I like to think of it like being a health data accountant. It's a little bit more like accounting than it is, being a programmer of sorts. But I'm also the founder of the Hit Like a Girl podcast. So the HIT is an acronym for Health IT. And we essentially amplify the voices and contributions of women who work in the healthcare and health IT setting. And there's no shortage of amazing women to speak with. So we are fast approaching our 100th episode and have tons more to go, but I'll stop there.
Awesome. Thanks, Joy. And it's an awesome podcast. I listened to one episode today in researching this, so I highly suggest you check it out. And I think Joy left a link in the chat, but if not, she'll get to it. And I will just go in order the Brady Bunch squares. I will hit ask Shailvi to introduce herself.
Hi, everyone. Thanks so much, Ali and Gabriella and Denny and everyone for hosting. And my name is Shailvi Wakhlu. I am the Senior Director of Data at Strava. So for those who are not familiar with Strava, Strava is the leading social platform for athletes and the largest sports community in the world. We have over 86 million athletes and we're across 195 different countries. So I have, right now at Strava, I lead the data org, which is made up of a bunch of very capable product analysts, as well as some machine learning engineers. And I've been in data for a long time. I've been in healthcare on various sides of it, on the fitness side, on the sports side, as well as the academic side of it. And so, yeah, thanks for having me today. I'm excited to hear what all questions everyone has for the group today.
Wonderful. And then we will round it out with Kathryn, and then we'll hit up Carla.
Yeah, thank you for having me as well. Happy to be here. My name's Kathryn Bonesteel. I am the head of partnerships for a banking AI company called Scienaptic. We primarily focus on financial inclusion. In addition to that, I am the co-founder of a company called NixCovid and another company called Nixie Technologies. To date, we've helped deliver over 5 billion pieces of PPE to frontline workforces across the country and across the world. We've supported vaccination efforts and have been quietly launching AI that helps screen for COVID-19. So happy to talk through some of that. I'm also a US patent holder for a device that helps people quit vaping. It plugs into a disposable vape. So on the health and wellness front, that would fit. And then in addition to that, I also do guest lecture at several MBA programs across the country, and I'm on the National Small Business Association Leadership Council representing the state of Texas. So happy to be here.
You can't say that you're not busy, Kathryn. So we'll actually come back to something you said. We just got a question in the chat, great question about machine learning and AI. So that's something you just mentioned, AI, and I will also kick it to Carla because you are in that arena. So could you tell us a little about yourself?
Yeah, definitely. Hi, everyone. So excited to see people from all over the world, on this panel discussion, but also in the audience today. I'm Carla Brenner, and I met Joy a couple years ago at the health conference, and so glad to be here on this panel with her. I work for an organization or a company called DataRobot, and we do AI and machine learning for the enterprise for businesses to manage their data, manage the machine learning models, and push those models out to production. So I work primarily with very large pharmaceutical companies, like I'm sure you've heard of AstraZeneca and many others like that size, as well as hospitals here in the New York, New Jersey area. And I run an organization called HealthTech Women that I've been running for 8 years now, and we support women who are innovators in the healthcare space, bringing biotech, pharma, med device, life sciences women together to support each other, to really leverage our network to help each other learn and grow in the health space. So I'm really excited to be here and happy to answer your questions.
All right, folks, that rounds out your panel. Amazing contributors here. So data and healthcare are, you could never call them boring. They're always innovating. They're also contentious. There's some sensitivity in terms of data security, who is spying on my health records, so on and so forth. And so the first question, I will toss it to Carla, and then I'd like to hear from Kathryn, and we'll move on down the line. And it's a question that's pretty pertinent and helps us understand like where you're coming from. So what is a key project that you're working on? And for Carla and Kathryn, I would like to sort of interweave a question that we got, which is like, is machine learning important in the public health and healthcare space? So Carla, you kind of alluded to it on your day-to-day, but I was wondering, like, what's a key project you're working on in the moment that is non-NDA, not NDA touchy, but and how are you doing machine learning with it?
Yeah, so I'm gonna answer this at a very high level because I think one of the biggest things right now is for companies to leverage AI and machine learning models. So we all know there's more data, right? We have Strava, we have Fitbit, we're collecting our data, hospitals are collecting their data, pharma companies, healthcare, life science companies, right? We're all collecting data to make better decisions about our health and to also help physicians and healthcare workers, as we can see, give us the best advice to move forward with our health, right? Or recommend things that we should do for our healthcare. And the issue is there's so much data, as we all know. And so being able to take that data, right, make sense that data, as we know, and then leverage it based on external factors like changing landscapes such as COVID, maybe different patterns, maybe the like we're seeing, you know, the changes strain, right, in COVID, right? So how can we leverage the changing landscape in data? And so one of the biggest movements is enterprise data, right? So meaning that companies have all these engineers, data scientists, and they're spending hours creating models, basically saying, I need an answer for something, and creating models that will get them the answer, right? So for instance, where are the biggest, where's COVID emerging, right? Or re-emerging with the new strains. And so they're spending a lot of time. And so being able to leverage models that have already been created around this and quickly iterating and quickly bringing in data, make it a lot faster and easier for these big pharma companies to pivot, right? To figure out where they're going to focus, right? What patients to focus on, where there are red flags, versus the old way of spending hours and weeks and months creating models to come up with a decision, right? And so what we're finding is companies are now being able to use data warehouses from Snowflake, from Amazon and Google and Azure, and consolidate the data across these different sources and quickly push out results of where to focus. And so I'm saying that at a high level because there's thousands of use cases in the healthcare space. But the biggest challenge is getting that data to realizing value of that data quickly. And so if companies are not leveraging AI in a streamlined way, their competitors are really going to be a lot more advanced. But also the US, the government, is going to lag in quickly identifying and making decisions. So I wanted to just say that at a high level so that this audience understands the way that I'm thinking about it of, there are point solutions, which I think are super valuable, right? So AI in X-ray images, AI in very specific healthcare use cases. And then there's enterprise, like thousands of use cases you can identify across the business.
Right. I think that makes total sense. And I think talking about it at a high level is very helpful for audience members who might not have a good sense of data in healthcare, and just understanding that skeleton, that landscape is helpful. Something occurred to me, like, you audience members know about us, but we don't know about you. If you've done data modeling before, throw a 1 in the chat. If you have not, throw a 2. If you feel comfortable. But I'd like to toss it to Kathryn to also be able to respond to that question, because I think I'd like to know from you, like, what is a key project that you're working on at the moment?
Yeah, so right now, as I touched on a little bit in my introduction, our biggest goal that we're trying to help is, as the same as many people, is to help nix the COVID-19 crisis. We are trying to combat that in many different angles. I think one of the biggest challenges that we are facing comes back to that compliance issue, and it also comes back to the tracking issue, right? I think there's disparate data across the country and across the world. Different hospitals are using different systems. We have little paper vaccination cards. There's not a central database where this information is being held and it's being updated. So in terms of predicting and using AI and modeling to foresee some of the potential damages that could come in the future, we don't have a lot of visibility. As you know, with AI and machine learning, it requires a significant amount of data to pull together accurate predictions on, things of this size. And so the more that we are able to pull that information together, the stronger we will be at predicting things like this from happening in the future. As part of our efforts to doing that, we have developed an AI machine learning based COVID screening tool. We've done this in partnership with a team out of Spain that is a group of world-renowned ophthalmologists, amazing developers, and Nixie is helping launch that in the United States. It's an open API, and our hope with that open API is to use that opportunity to put the technology in as many hands as possible so we can strengthen that disparate data challenge that we're facing right now as a country. I think, in my experience working with hospitals, I come from a patient perspective primarily. Prior to COVID, I worked for companies like Salesforce and Infor and SAP primarily around the customer experience, but I have some significant healthcare issues. And from the conversations that I've had with those physicians, there's a lot of legacy systems that are in place. There's tools like Epic that really don't have any predictive capabilities at all. They don't even have predictive analytics. So that's like step one, prior to approaching any AI or machine learning conversation is what do we have and how can we use it? And then also, how can we use it when it comes to patient privacy and data privacy and concerns, which I think are upfront and top of mind to many of us. I think our number one goal is to try to help as much as possible from a screening and prevention process, from getting PPE in the hands of people that need it, from getting screening in the hands of people that need it. And then the secondary challenge, which we're looking to help address, and I think it's a challenge that we need as many talented people to jump on to help, is to come up with a creative solution universally that we can use to prevent these types of things from happening in the future.
Wholeheartedly agree. So thank you for sharing the project that you're working on. Obviously very topical, very poignant and very important. So let me I want to get to Shailvi, and I want to get to Joy. So we do the introductions and everyone knows what we're working on. Shailvi, I read something kind of interesting, something that you said. And so maybe you could weave it into the response of what you're working on. I saw something that said, you wrote that bad data has the capacity to ruin your business and can have dire consequences for your users. And you speak a lot about data and the ethics behind data. So having said that and revealed a little bit about yourself in my research, what is a key project that you're working on today?
Yeah, I'm so glad you came across that, little bit of paranoia that I try to incorporate in every who's trying to work with data. So, I think, for us at Strava, one of the learnings over the last year and a half has been that everybody has their own journey, that their fitness journey, their health journey, just their life journey. And we are trying our best to find people wherever they're at, to try to add value in the way that we can help. And we can help them on their fitness journey, we can help them on their athletic journey, and that's what we want to maximize. So I think, for a company to be able to do that effectively, we have to get really robust at our decision-making process, because we, at the end of the day, in our company are using the data, usage adoption data, to try to figure out what is the best and most useful product for our athletes that's going to add value to them, that's going to, bring that little piece of joy in this crazy world that we live in, where they feel they're in control of something that they're working on for their own self-improvement. And so for that, I think, decision-making has to be very firm. It has to be rooted in data. It has to be scalable. It has to follow some sort of frameworks. And that's sort of the project that I'm working on, with my team, that we're trying to figure out how do we make a scalable framework where we are able to make these decisions faster, where we're able to incorporate the voices of our customers and the outcomes that they'd like to see. And in that context is where that bad data piece comes in, that if you're using data that is inaccurate, incomplete, or misleading to make decisions, you're going to have bad decisions. And especially like when you're talking about people's health, when you're talking about people's disease burden, those bad decisions can really change the outcome and have a very negative impact. So I feel, in this industry, it's almost it's a requirement for us to be very intentional about those pieces and to be very thoughtful about the impact of the products that we build and who takes what decisions based on it.
Amazing. It's nice to see that like the pivot or like the approach that Strava has taken over the past year and a half and meeting someone where they are. And last but definitely not least in any regard, Joy, what projects are you working on right now? Or one project?
Yeah, I'm like, I've got quite a few. But
I know, you're a busy lady.
But one thing that's been showing up for me lately is I confirmed a factoid last week that was the absolute numbers of women who are studying STEM is going up, but the percentage is actually going down. We are in fact losing numbers of women in these in the STEM field. And so I am sort of on a personal mission with the podcast to sort of help the women coming behind us, that to know what careers are out there, what are available to them, with the thought being that you can't really be what you can't see. So can we lift ourselves up and just kind of identify? And so on the show, we talk about like, what is each individual's piece of the health IT puzzle? And, it's a 5,000 piece puzzle. How can we put it all together? And so instead of just talking about, what we all do, I feel like I've gotten far enough that where I'm headed next is how do we connect all of these puzzle pieces? So I'm in the process of creating what I'm calling a mastermind event, some sort of salon to bring women together around a specific topic. The topic that I'm most concerned with and I'd like to lead with is maternal and infant mortality rates for Black and Brown communities, and trying to find the underlying sources, like, okay, where are we getting the worst outcomes? What are the common denominators in those places? And how can we as women take our pieces of expertise and knowledge, if we have influence and decision-making powers, to go back either to our organizations or communities to make a difference. And so my project is to try to get a solid invite list of women who are extremely knowledgeable in that area and who would benefit from knowing and working together so that we can create what I think of will end up being as sort of a task force to just really get strategic about how can we have more positive impacts in that area.
Wonderful. FemTech Focus also has a podcast, and we interviewed Kimberly Seals-Allers, who's the CEO of Earth, and she plays in that field. She plays in African-American mortality rates, and she's created an app to address that. So just passing that bit along, we can connect later. But I think just trying to let folks know out there, a cool person to check out. This is a question that I'll throw out. We actually received it from the audience, and it'll popcorn. If you would like to answer the question, please go ahead and do so. Not everyone needs to answer it if you don't want to by any means. Someone just asked in the chat, like, what is, we've talked a lot about data, and when you're talking about your individual projects, which are very pertinent and they're all over the place, which is great, it's diverse. But someone asked, like, where do you see like AI or data activists as part of this equation? When we talk about data, we talk about healthcare. Tangentially, if we're talking about current events, I know that Twitter and this is not healthcare related, but Twitter just hired like a cohort of consultants that just focuses on AI. It focuses on data activism and ethics around how Twitter collects data. And so that's something that maybe might touch healthcare, but I think more and more companies are thinking about hiring folks like this to be mindful of all the data that they collect. So I just wanted to throw that out there as an audience question. If you have a response or something you'd like to add, please let me know.
Yeah, I mean, I'll just jump in really quickly. I think that you made a really good point. So right now, as companies realize that that AI and machine learning is needed and leveraged across the business. They're realizing ethics and biases is really, really important, as we heard from one of my other panelists here, that you don't want bias. Bias leads to wrong decisions because you're not getting the full picture. You're only getting part of the picture. And so companies, as part of their IT strategy, are hiring an AI ethics person. We just hired someone who presented at HIMSS, actually. And you're seeing that more and more. So I don't know if folks in the audience were recently at HIMSS, but there was a half day kind of focus around AI ethics. And you're seeing that more and more because it's a big issue. And we're just on the cusp of this right now, because companies are realizing that in order to get the best outcomes, you need to constantly be collecting data so that you can make those algorithms work for you. And the longer the earlier you have the information, like think of Google, right? Google has been collecting information. So now when you search in the bar, it's kind of like they think like you, right? And so companies are just realizing that they need to, if they're going to leverage AI, they're going to need an ethics person.
That makes sense. That makes sense. Like, that's a great perspective of thinking about Google. Does anyone else from the panel have a response? If not, I've got a new question.
I actually do have another, and yeah, definitely echo the thoughts from Carla, but I feel that, especially since we're talking about data in the context of healthcare, one thing that I always remind ourselves is that healthcare is one of those fields that has a very strong code of ethics that are widely adopted, widely understood. You can be in different countries and there's still a lot of synergy between those code of ethics that people follow. And if data is playing in that field that has these very strong code of ethics, it again becomes important that why shouldn't data also have that same attitude towards being very being good stewards of whatever it is that we're pushing forward. So very excited to see how as an industry we move in that direction.
And I'm kind of curious, if anyone in the audience, like, do you have an AI ethics person at your organization? Are you part of the committee that thinks about bringing in someone? Just so curious where this group falls.
Yeah, maybe respond with yes, no, or that's not even a thing where I work. Because I think it's because it is a new adoption and it might not be a thing. See. So I think it's good to know, but yeah, thank you. No, we're too small. That's not even a thing. So I think that this isn't necessarily the end of days. Like I said, it's growing. More companies are sort of keeping this top of mind in terms of protecting healthcare data, especially like whether it's in genuine interest or maybe it's like a PR stunt. You can't argue either way. But I want to go ahead and go back to a question that I think kind of I would like all four panelists to answer, actually, and it kind of touches on this a little bit. And I'll start with Kathryn. And so my question, Kathryn, is like, what do you think is the biggest challenge in healthcare right now? And we don't have to go back to AI and ethics or anything of that's concerned. We can go totally left field, but just would love to hear your voice.
Yeah, I would say the biggest challenge right now is COVID. I might be a little bit biased just because of my area of focus right now, but I would say across the board, it's COVID.
Well, that was very straightforward and a good win there. Can't argue that one away. I will ask in the order if I see the Brady Bunch boxes. Shailvi.
Yeah, love that crisp sort of pointed focus. Yeah, I'd agree that, I think we're at a moment right now where we have to make sure data is not doing any harm, especially in the healthcare space. And figuring out how to best do that, how to best create policies and just best practices around that is going to be really, really important as we move forward.
One
Joy.
thing that sorry, go ahead.
No. I'll get to Joy first, and then I'll circle back to Carla. Promise.
Sorry.
I would actually, I mean, I think it's related to COVID, but really the highlight of access, of who has access to healthcare and the equity space. I just think that it, you know, we're seeing more and more who has, you know, a great access to healthcare services and folks who don't. And there's definitely, you know, unintended consequences and terrible consequences for folks that are not able to get the care that they need. I can be succinct as well.
Okay. I definitely, I will follow up on that, because I'm just wondering what the data shows. Like, how do you paint that picture? Because that's something you could take off, you could take for face value, but what is the data saying? Like,
Well,
how do you quantify that? Like, how do you follow those trends?
Well, I think you might quantify that between, I don't really have access to all of that data, so I wouldn't be able to say, oh, this report shows. But I think when you talk about, you know, people who have access to smartphones, or they have different apps that are available to them, you could see the data of like who has that and who doesn't have access, or who actually has healthcare coverage versus who doesn't, and who's actually going into the hospital or using the urgent care setting as their primary care services, that sort of thing. You can see that in coding, and kind of dig it from that angle. Does anybody else want to add into that? Yeah.
No, I think, first of all, I think that's perfect. It kind of gives us like a place for starters to do our homework, because I was like, that's a great point. You know, where do I get to reading if I wanted to learn a little bit more about that? But thank you, Joy. And I'll go to Carla. Carla, what do you think is the biggest challenge right now?
Yeah, so I want to agree that all these things are challenges within healthcare, you know, the end user, but also when you talk to hospitals, as we all know, because we've been a patient before, and we all know that, you know, hospitals are getting really constrained right now based on resources, specifically around funding and costs, and figuring out how to allocate resources, right? Especially not only personnel, but just funding, right? And dollars. And I think the biggest challenge is, especially as they're bringing in more data and trying to figure out how to target patients and which patients to keep out of the hospital, right? And which ones to bring back in at a certain time and follow up with. I think it's really, hospitals in particular, healthcare systems are trying to figure out what technologies are best to invest in to really get the right outcomes that they need. So the ROI of the investment and how to actually figure that out, just from a technology perspective, has a lot of challenges right now as we're talking about constraints of specifically the healthcare systems.
And I have something to add on that, if that's okay, Ali, if I could jump.
Yes, go ahead, Kathryn.
Appreciate that insight, Carla. I think it really resonates with what we've heard and what we've seen from the data we've had working with at least hospitals in the area. I think overall across the board right now, especially in population dense areas, we are seeing short staffed issues and overcrowding at the hospitals. Due to that, they're having to make decisions a lot faster and in real time. In some cases in the Houston area, my best friend's an ER physician. They've had 40 or 50 people in the waiting room. And so with that, they're trying to move really quickly and make patient decisions without having a lot of those tests already done, having to try to make those calls in real time as to who to prioritize and who to move in, who's going to get a room and things on that nature. So I think that's where, you know, we putting on our data lenses might be able to provide value and help alleviate some of that stress on them, is to try to help leverage what we do have and what we do know about a patient's history, and different, parameters for that area to help make recommendations on that decision. I also think that most of the systems that they're using right now, like Epic or core systems that they use to manage patient records, still require significant manual entry of data and information. There might be lab tests that are automatically updated, but when it comes to, those patient interface, the conversations that you have, that medical history that you get from a patient, that's all a huge manual process. And so oftentimes we'll have a scribe following them around to help fill out the chart. And so figuring out how there might be a way to help maybe auto-populate some of that information. Maybe there's a quicker way to use voice dictation, more drop-down fields to make the data more universal to where it could easily be combined with other sources might be an avenue of consideration as well. I would say that for the most part, what we've seen is that the physicians themselves actually hate the systems that exist, one from the UX component and two from the manual data entry component that's required.
Yeah, no, that makes a lot of sense. And I want to ask the next question. So just to sort of level set right now, we have about like 15 more minutes in this webinar. And so I want to get to two questions. One of which is an audience question that piggybacks off what Kathryn just said. So I sort of want to like switch train tracks a little and acknowledge the fact that all of the panelists here come from different backgrounds, whether it's being in a podcasting space or a health app or you've got Nixie, all sorts of things across the board. There have been several questions in the audience from the audience members that hinge around the same thing, and it's really skill set. So the question is, are there certain tech skills needed to work in as part of data in the healthcare industry? So like, for example, you just said like drop downs in UX. I'm thinking, okay, like UX could be a big part of it. Maybe R and Python, I'm not sure. But what would each of you say is like a big skill set that someone in the audience could adopt so they can start kind of opening that door to data in healthcare? I'll start with Shailvi.
Yeah, great question. I think, from a technical skills perspective, definitely knowing how to code, knowing how to manipulate data, and, whether the most basic level just starts with SQL. And I think I enjoyed the R versus Python thing because I know that comes up often. There are some very strong camps on both sides, but I would say that, generally speaking, if you at least know one of those languages really well, or maybe some other comparable language, you're in a very good space. And the rest of it, again, you don't have to have a degree in it. I'm very, very passionate about making sure that people know that you could have gone through a boot camp or you could be self-taught. You still have a lot of value to add in this field. So, never be afraid of going after opportunities in this field because you don't feel you went to school for it. Because I can assure you, you have a lot to add from just your empathy and your passion that you would bring to it.
Thank you, Shailvi. And a quick shout out to General Assembly, who has Python classes in these bootcamp classes. And I just want to say towards the audience and really towards the panelists, everyone, so there's no wrong way to answer this question, because it just really depends on like what angle you're coming into data in healthcare, whether you're podcasting or you have your startup as an entrepreneur and you're trying to raise VC funds, whatever it is. I think it's interesting to see the ecosystem. And with that said, I will ask Joy to give her answer to the question.
So, I've spent the last decade looking in a bunch of EHRs and trying to ask questions of what's the quality data that is within different EHR systems. And so my organization, we try to be as agnostic as possible. So that means the skill set that our team has is one, knowing the data that is being asked of from the government and trying to figure out if the EHR system is able to produce that data, or if it is accurately producing that data. And so sometimes that means that people will be doing all kinds of work within their system, but the data isn't being structured in such a way that it can be easily translated. And so knowing how to either customize workflows, build different reports, really just like trying to be the connector between, hey, what is being asked and how do we get that information to them in a way that is meaningful is a great skill set. And a lot of that is just being able to kind of it's not SQL, it's not R, it's not Python. It's literally just being able to recognize, okay, what are the results or the output of these reports, and are they going to be able to get me what I need, or the organization what they need? Yeah.
That makes sense. Like the ability brass tacks to read and kind of provide concise feedback and just what are the trends and really extrapolate. So that's sort of what I'm hearing from you. And it's really cool to hear that you've been in the field for so long. So thank you, Joy. And then I will ask Carla. So what would you suggest that someone start at in terms of sharpening their skill set?
Yeah, so I think you mentioned taking a step back and figuring out kind of the technologies. There are so many like first you want to understand what what part of the AI you want to be involved in, right? Is it the coding? Is it the modeling? Is it the analyzing the data once it's pushed to production? Do you want to use visualization tools? You want to be an expert in Tableau, right? Visualization tools where you don't necessarily have to do the coding, right? Do you want to work with the underlying text, the data warehouse, and bringing that into, figuring out what data you're pulling together to push to machine learning models or AI models, et cetera. So I think you want to take a step back and figure out what part of that puzzle you want to focus on. And then there are so many technologies in this space. And what I would really advise is understand those, like maybe, even if you Google, but just understand the technology across the different continuum of what you want to focus on, and really become an expert in that particular area. So pick a technology and learn that. And I think that could be leveraged across any company you join or start.
Awesome. That's a well-rounded answer. Thank you, Carla. And then lastly, I'll ask Kathryn, a woman of many talents. Where would you start? Where would you start?
I would say SQL is a good place to start. I think that's a great place to start. I appreciate what Carla had to say and understand the advice to specialize in a given area. I had a professor in college one time give me a piece of advice, and it was to not be brilliant at one thing, but to be good at a lot of different things. And that has really stuck with me throughout my career. I was a government major for undergraduate. I self-taught with online classes like General Assembly to teach myself tech, and ultimately was able to pivot and transition throughout my career to things that mattered to me, that I had a passion for. So I would recommend, yes, truly become an expert in what you care about and what you love, but also to invest a little bit with things like General Assembly to learn, little different components about different areas that you might be interested in, and that could set you up for a pivot down the road and down the future. I think the nature of the business that we're in is automation. And so as tech gets smarter, how can we differentiate ourselves from that tech that we're building to, have that job security and continue to help with innovation. I also think that the data going in is just as important to what we're doing as the models that we're building. And the more that we can focus on increasing adoption and ultimately that user experience, both on the patient side, patients filling out things in advance, collecting that written information, those multiple choice questions before they come into the physician side, the nurse's side, creating some type of interface where it's easy to use on your mobile phone, lots of legacy systems out there. And so helping bring those up to speed to where it's just as easy to update a patient record as it is to order your groceries on Amazon would ultimately increase the value of the data that we're collecting.
Awesome. So I have my last question, and it kind of hinges on what Kathryn said, again, always poignant. Basically like data and healthcare offer a lot of opportunity. The challenges can seem insurmountable, but the bright spots are just very much there. So I'm gonna give you each about a minute and a half, so we can stay on time, to let me know, like, what are you optimistic about in the future? Like, what is a bright spot when it comes to data and healthcare? And I will start with Joy.
Dang it. I mean, honestly.
Do you want me to come back to you? I can totally come back to you.
No, that's okay. That's okay. I mean, I think the bright spot is knowing how many people care. I think healthcare, more than in many other industries, is that you just get a lot of really good people. There's good people that care and, you know, more than anything, like are doing their best to make a difference. I think it's, you know, we struggle with people that are experiencing burnout and, you know, lack of resources or whatnot. But ultimately, I think that there's a lot of people showing up, giving their all, and have, you know, just like a good vision for where we want to go. I think we all know that we have a long way to go. Like there's a ton of work to do, and it's formidable when I like think about it. But I think that, you know, we're in good company of just knowing that there's good people within this industry.
Hear, hear, and smart as whips. And I will ask Carla the same question. What is a bright spot?
For me, I think, you know, I'm going to go back to automation, right? So I think there's now, by automating a lot of things that that were manual tasks, created burnout, right? We're seeing that in the healthcare space, and oftentimes like the hospitals don't want to invest in technologies that can do a lot of automation, that can read things a lot faster, right? Scans that are able to detect whatever you're trying to find in the healthcare system, and doctors are getting burnt out because they're seeing a lot more patients. So through automation, so hopefully we can get, you know, healthcare systems, pharma companies, the greater, you know, all these different verticals of healthcare, if they can leverage AI, people can focus on the things that matter most, and we can reduce physician burnout. We can get to answers quicker. We can leverage the data across different, all these different types of patient data, clinical data. If we can all start leveraging automation in a way that is fair and unbiased.
I think that that's a great answer. And entire webinars and workshops and college, you know, university classes and semesters are spent on automation, especially in this particular industry. So if you want to catch up with what Carla just mentioned, it's incredibly important. And there are many means to look after it. And with that said, Kathryn, what is the bright spot? What is a bright spot for data in healthcare?
Yeah, I would say the bright spot for data in healthcare is that this sadness that we're all going through has inspired so many people to step up and try to make a difference. I think that some of the challenges that healthcare systems have seen have now caught the attention of everybody around the world, that there are so many people that are empowered either from their homes, on their couches, they're going through a career shift, they're thinking about things and how that they can potentially make a difference. And having this movement towards online classes, having this more flexibility when it comes from work from home, that paired with the challenges that we're all facing, I do feel like a lot of people are more open and more willing to jump into new careers and new opportunities and continuing learning, and particularly in the healthcare field. So I think we're going to see some amazing innovation over the next couple of years from women like ourselves as stepping up and trying to do their part to help, you know, solve these challenges. So I think it's really cool.
It is really cool that it's something negative can spur something positive, or many things positive. So thank you for that. And last but not least, I will end this amazing question, at least I think so, with Shailvi. Shailvi, what do you see, you know, given your professional experience in data and just hardcore nose to the grindstone, what is a bright spot as part of data and health?
Yeah, thanks. I'm so excited in this field in general that, you know, I feel like we're at the center of being in a position to make a lot of impact and affect real people's lives for things that they care about, you know, health, fitness. Those are real concerns that people have on a daily basis that they're trying to maximize. So for me, the bright spot is definitely that I find that the industry is becoming very intentional about prioritizing equity and inclusion. It is no longer something that's an afterthought. I think that's going to be extremely meaningful as we move forward, because you know, if we prioritize inclusivity from the beginning, we have the capacity to catch a lot of problems that become bigger later on early enough, where we can make sure that everybody has the right outcomes for them. So I'm super excited for anybody who wants to, step into this industry, and happy to offer resources wherever I can.
Awesome. Thank you so much. I think we're about at time. We got a minute left, so I'll wrap it up. Thank you so much to each of our panelists for just offering their insights today. It was great to hear from such diverse perspectives. Joy, Shailvi, Kathryn, Carla, you guys are amazing, and it's great to hear your perspectives again. I just want to thank the audience for your questions. We didn't get a chance to get to all of them, unfortunately, but like I said, please, connect with us on LinkedIn. The links were dropped in the chat, so make sure that right before we hit leave in the Zoom, you check that out. So you got a couple seconds. And thank you to General Assembly and Women in Data. You should definitely check them out for having us here today. So thank you so much for your time.
Thank you, everyone.
Thank you.
Thank
I will
you.
tell them quickly that I will be sending out email from uswest@ga.co with the recording, and I will try to summarize some of the resources that you can see in Zoom chat. So keep an eye on that. Thank you all so much.
Thank you.
Thank you.
Bye.
Bye.